If you or a loved one, or maybe a patient, is dealing with the long-term effects of radiation damage, you're likely looking for every option you can find to support the recovery. Should hyperbaric oxygen therapy be on that list? Radiation therapy has been used for decades inside of cancer management, and in many cases, radiation therapy could be life-saving. At the same time, radiation damage of the nearby tissues is pretty common when using radiation therapy as part of a cancer treatment. In some cases, the damage from the radiation doesn't even show up for many years after the treatments have already been completed. In today's video, we're going to walk through the effects of radiation, where hyperbaric may fit or be supportive, and what a realistic protocol might look like if you're wanting to use hyperbaric as part of your recovery process. I'm Dr. Jason Saunders. I've been in the hyperbaric industry for over 20 years, treating patients, doing research, and teaching and training practitioners and technicians in hyperbaric medicine, trying to improve the access and the safety of this therapy in an attempt to make sure that anybody who wants or needs hyperbaric oxygen has access to it. The literature says that around 10% of the patients who receive radiation therapy end up with long-term tissue damage in the areas nearby where the radiation therapy was done. In my clinical experience treating hundreds of patients with these types of issues, I would say that that estimate seems too low, and that radiation damage is far more common than that. Radiation therapy is well known to cause tissue damage and cell death. In fact, that's the exact reason we use radiation in the treatment of cancer, is to target and kill the cancer cells. Over the decades, we've gotten far more precise with how we deliver that radiation therapy to limit the amount of surrounding cells and tissues that are exposed to that radiation. Nevertheless, it's inevitable that some surrounding tissue will suffer damage alongside the cancer cells when treating somebody with radiation. This can result in blood vessel damage, this can result in nerve damage, or really any of the surrounding tissues that was adjacent to the tumor that was being treated with radiation. This can cause a number of different symptoms, from neuropathy to endocrine dysfunction, and even tissue death to some of the local areas due to the blood vessel damage that radiation may cause. As the blood vessels are damaged and blood flow is impeded, often tissues can become hypoxic and eventually necrotic. In other words, low oxygen leading to cell and tissue death. And unfortunately, this delay could take years to come to the surface. And as a result, there's a delay in other useful treatments that could have minimized some of those consequences, especially if administered sooner in their care. As the body is healing from any injury or any damage, it goes through different phases of recovery and repair. In order for any cell or tissue to really mature and heal, it has to transition from the inflammatory phase to the proliferative phase of repair. The number one ingredient required to make that transition is oxygen. And as these blood vessels are often damaged in radiation, especially the microcirculation, the capillaries, where gas exchange occurs, we're no longer able to deliver adequate oxygen to those damaged cells and tissues. And as I said earlier, this results in hypoxia and then eventually tissue death or necrosis. We need to have an oxygen gradient in order to promote the healing and move from that inflammatory phase to the proliferative phase, and then ultimately to maturation, where injuries are fully healed and recovered. Hyperbaric oxygen is by far the most powerful and the most efficient tool that we can use to drive the quantity of oxygen inside the body high enough to create a sufficient oxygen gradient so that those wounds, so that that tissue can finally repair the way it needed to. Moderate to severe radionecrosis, or tissue death from radiation therapy that's moderate to severe, is even an FDA-approved on-label use of hyperbaric oxygen. Unfortunately, as with many on-label uses of hyperbaric, the criteria for getting it approved needs to be very severe and significant. And as a result, many of the people who might benefit from hyperbaric oxygen aren't getting it covered or aren't even getting it offered because they don't meet that criteria. In fact, the same way that hyperbaric oxygen could help somebody with moderate to severe osteonecrosis would also benefit from hyperbaric simply in a mild form, or even post-radiation therapy as a preventative to try to offset some of these radiation necrosis or radiation symptoms that are associated with post-radiation treatment. Taking that one step further, it could even be something that's used prior to going into a round of radiation therapy, as hyperbaric has been found to be neuroprotective and tissue protective. In other words, raising the oxygen levels and beginning a process of reducing inflammation, improving oxygenation, improving tissue resilience, and stimulating a healing response prior to going into radiation may even prove to be protective against some of the radiation damage without interfering with the goals of the radiation therapy itself. Radiation therapy is typically pretty intense, usually 1 session a day, 5 days a week, for weeks or months at a time. If you're not familiar with hyperbaric therapy, you should know that hyperbaric is also often recommended 4 to 6 sessions a week for 6 to 8 weeks at a time. And so therefore, doing a full protocol of hyperbaric while also doing a full protocol of radiation is not realistic. And in fact, it's not even recommended. For the most part, if you're using radiation as a tool for treatment of cancer, you want to allow the radiation to do what the radiation is supposed to do. There are times and cases where doing a full hyperbaric protocol prior to starting radiation could be appropriate for its neuro and tissue protective components. There's also absolutely a time and a place to create a full hyperbaric protocol after radiation is complete for its tissue recovery and tissue repair and protective nature in an attempt to try to reduce the consequences of radiation damage and radiation therapy. But you would have to be very purposeful and careful if and when ever trying to combine hyperbaric treatment with radiation therapy at the same time. That's not to say it can't be done, but the protocol would look vastly different if that was ever the case. And for the most part, it wouldn't be a full protocol of hyperbaric multiple times a week for weeks and months on end. It would be intermittent exposures in between radiation treatments or on radiation breaks. And in this case, the goal would really have more to do with just taking the edge off and trying to feel healthier and stronger as you're managing this intensive radiation program. Even though radiation necrosis is an on-label and approved use of hyperbaric oxygen, I would still argue it's not the cure for radiation injury. It does address a lot of the root issues associated with radiation injury, rebuilding the microvasculature, rebuilding the blood vessels, hyperoxygenating the tissue that's become hypoxic and necrotic, stimulating neuroplasticity and nerve repair if there was any nerve damage, initiating a healing process, moving from that inflammatory to proliferative phase of healing where growth factors and stem cells are being mobilized to heal, repair, and regenerate the damaged tissues. But of course, not every patient with even a similar radiation injury is going to respond the same way. Just like radiation treatments may vary person to person, the hyperbaric benefits are going to vary person to person, and the hyperbaric protocols will vary based on the experience that those patients are having. We're not using hyperbaric oxygen to cure the injuries as much as we're using hyperbaric oxygen or the benefits of oxygen as a way of driving oxygen levels up to support the natural healing process of the body post-radiation. As with every other therapy that you can think of, including radiation therapy, consistency is key, and following the right protocols is paramount to getting the results that you're looking for. Whether you are using it from a protective standpoint or you're using it from a healing and recovery post-radiation standpoint, the consistency of care, the multiple times per week for weeks and months at a time, is really what's needed to extract the benefits that you're looking for if you're using hyperbaric in conjunction with radiation therapy. Hyperbaric oxygen is not going to replace any other medical or surgical intervention. It's not going to replace chemotherapy or radiation therapy. Some patients are looking for alternative therapies in lieu of traditional treatments. Some patients are looking for alternative treatment options in conjunction with their traditional treatment options. And some patients have already gone through all the traditional treatments, and now they're just looking at additional ways to support themselves through the management of their cancer diagnosis. In any of these cases, collaboration between your different providers is really important. Having the doctors understand which options you're choosing and in whatever way possible, work together to help you reach your goals is always going to be the best approach you can take when trying to manage such a complex diagnosis. Along those same lines, while this video is very specifically geared towards using hyperbaric oxygen to help recover from post-radiation necrosis or post-radiation damage, I know that a lot of patients with a cancer diagnosis out there are looking for additional therapies, again, either in lieu of, in conjunction with, or after traditional treatments have been exhausted. And we've done an entire video on how to use hyperbaric oxygen or where hyperbaric oxygen fits inside of general cancer management. So if you're interested in that video, here's a link to that video. Check it out, and that'll answer additional questions that I'm sure that you have with regard to using hyperbaric oxygen and where it fits in the overall management of your case or the case of your loved one. Thanks again for your time and attention, and I'll see you on the next video.